Good day, global citizens. Welcome to another episode of Dr. Fajembola's Opinion. This is a platform where research meets understanding and legacy. We have been discussing recurrently HIV, and today I bring another guest researcher who is here to discuss and explain his publication on HIV. So, do me the pleasure of welcoming pharmacist Abakar Abba. I hope I got Pharmacist Abakar Abba. Pharmacist Abakar, how are you doing?
Yeah, thank you so much, and it's a pleasure to be here. Looking forward to the conversation that this
Thank you
platform.
so much.
Thing is, whenever we hear the word epidemic, right, people usually refer that to maybe a disease or a condition that is happening at a disproportionate scale compared to the maybe population of a given geographic location. Some might argue that HIV is no longer an epidemic because it's not happening in that level of proportion in Nigeria. But then it's not just about the numbers, it's also about the persistence and the public health impact of the infection in Nigeria, right? If you look at the figures, currently we have about 1.9 million people living with HIV in Nigeria, and that makes Nigeria one of the highest HIV burdens globally. Right? Even though we have seen a decline in the prevalence of HIV from about 2.8 to 2.1%, which is a good one, right? We are seeing a decline in the number of people that are contracting the disease. But then even the current prevalence means that that proportion is still significant compared to 200 million population of Nigeria, right? So it's not merely defined by rising numbers, but also how consistently present it is and the level of significance it's above what is considered as a baseline or expected percent of our population based on the data currently above 85% of those that are living with HIV are currently on medication, which is close to the UNICEF target of 9%. But then what we have explored in the study, which is adherence to antiretroviral medication, will also be a new or will be a potential source of concern in terms of epidemic, because it's not just about biological events, right? We consider the social impact and then also the implication of poor adherence to medication. It's one thing to be on the medication, and it's another thing to consistently take the medication as prescribed by the healthcare practitioner. So I think these three key points made HIV to continuously being seen as an epidemic, even with the significant successes that we have achieved with treatment and control in Nigeria.
Thank you so much for giving us that great and thorough introduction. When we're talking about HIV medication, one of the rising problems that is usually discussed is adherence. Adherence, and you see people telling people, you see people have I've not seen anyone, no one has come to me, but you see people in public and on TV and on social media saying that they use a certain app and they became HIV negative, and they've been using some people believe that if you use HIV medication to a certain level, you automatically become HIV negative. You're not positive anymore. And I know the clinical scenario behind that. But when you talk about adherence, now this is for global citizens, people outside the field of health. When does adherence stop?
All right, thank you so much for this question. But I think, first of all, it's even important to define what adherence means in the context of maybe medication therapy as also as it relates to HIV, right? So when we say adherence, we mean the extent